So now we have here manifestation of grief. So for normal grief, we have verbalization of the loss, crying, okay, sleep disturbance, loss of appetite, and difficulty of concentration. Okay, so these are normal grief, okay, reactions. We also have your complicated grief, extended time of denial, depression, severe physiological symptoms, and suicidal thoughts. Okay, so these reactions or these responses are for complicated grief, and this is not normal. This is unhealthy responses. Okay, now let's go to your factors influencing the loss and grief responses. So age or your maturity can be a factor that could influence your responses towards loss and grief. Significance of the loss, okay, the value of that the value of that particular material or person to you, okay, that could affect or influence your loss and grieving responses. Culture as well, spiritual beliefs, gender, socioeconomic status, support systems, cause of loss or death. Okay, so we have here heart lung death. So the traditional clinical signs of death were cessation of apical pulse, respiration, and blood pressure. Okay, so these are your vital signs. Okay, if there is a cessation of your vital signs, that means it is a traditional clinical sign of death. There is a heart lung death. We also have your cerebral or higher brain death. Okay, another definition of death occurs when the higher brain center, the cerebral cortex, is irreversibly destroyed. Permanent loss of cerebral and brainstem function. Okay, this can also be considered as death, your cerebral or higher brain death. We have three types of awareness. Okay, we have closed awareness, we have mutual pretense, and we have open awareness. Okay, for your closed awareness, the client is not made aware of impending death. Okay, meaning the dying patient is not aware that he or she will die soon. Okay, so that is your closed awareness. Your mutual pretense, this is where the client, family, and healthcare personnel know that the prognosis is terminal but do not talk about it and make an effort not to raise the subject. Okay, so here the clients, the family members, and the healthcare personnel are aware of the poor prognosis of the patient. However, they decide not to talk about it. Okay, we also have your open awareness. Okay, the client and others know about the impending death and feel comfortable discussing it, even though it is difficult. Okay, provides an opportunity to finalize affairs and even participate in planning funeral arrangements. Okay, in your open awareness, clients and others involved in the care of the patient know about the impending death. Okay, and they are comfortable of discussing it. Okay, they even participate, the patient and others participate in the planning of funeral arrangements. Okay, so meaning they are open for that topics. Okay, next we have here hospice care. Okay, focuses on support and care of the dying person and family with the goal of facilitating a peaceful and dignified death. Okay, so the main goal of your hospice care is to provide a peaceful and dignified death. Okay, also we have here palliative care. So an approach that improves the quality of life of clients and their families facing the problem associated with life-threatening illness through the prevention and relief of suffering by means of early identification and impeccable assessment and treatment of pain and other problems, physical, psychological, and spiritual. Okay. So the goal of your palliative care is to relieve the sufferings of your patient. Okay. So for example, your patient is experiencing extreme pain. Okay. This usually happens for it happens to you cancer patients. Okay, they experience extreme pain. So your goal in your palliative care is to administer pain relievers. You need to manage the pain, and by managing the pain, you are actually improving the quality of life of your patient, although he or she is under palliative care. Okay, so we have to uh, relieve, okay, the sufferings of your patients. End of life care, so included in hospice and palliative care provided in the final weeks of before death of the patient. Okay, so this is your end of life care. Now we have your post-mortem care. This is a care given by the nurse, okay, after the patient has died. Okay, so we have here terms that we need to consider. So we have rigor mortis. It means stiffening of body 2 to 4 hours after death. Okay, we also have your algor mortis. Okay, means decrease of body temperature. Okay, we also have livor mortis, discoloration in dependent areas. Okay, so this happens after the patient has died. Okay, we also have here, we need to check clients' religion rituals and make every attempt to comply. So we have to facilitate any religious practices or rituals. Okay. If family or friends wish to view the body, make environment as clean and as pleasant as possible. Make body appear natural and comfortable. If family or friends wish to view the body, remove all unnecessary equipment, soiled linen, and supplies from the bedside. You have to follow agency policy when caring for tubes. Okay. Place body in a supine position. Place arms either at sides, palm down, or across the abdomen. Place one pillow under the head and shoulder. And also you have to close the eyelids, insert the dentures, and close the mouth of the patient. Wash soiled areas of the body and place absorbent pads under the buttocks. Okay, so when the patient died, his or her sphincters in the body relaxes. Okay, so when those sphincters relaxes, so body fluids come out from the body. Okay, so you have to put absorbent pads under the buttocks. Okay, place a clean gown on the client. Brush and comb the hair. Remove all jewelry except a wedding band, which is taped to the finger. Adjust top behind linen to cover the client to the shoulders. Provide soft lighting and chairs for the family. After the body viewed by family, you have to leave risk identification tag on for proper identification. Okay? Apply additional identification tags. After body viewed by a family, you need to wrap the body in a shroud. Okay? Apply identification to outside of the shroud. Take body to the morgue or arrange to have mortician or undertaker pick it up from the client's room and handle deceased with dignity. Okay. So what is your mortician or undertaker? It is a person trained in the care of the dead. Okay. What is shroud? It is a large piece of plastic or cotton material used to enclose a body after death. Okay. In the hospital, it is usually called as mortuary gown. Okay. So for your post-mortem care, the nurse collects data in accordance with desired outcomes, listens to clients' reports of feeling in control of the environment surrounding death, observe clients' relationships, and listen to clients' thoughts, feelings related to hopelessness and powerlessness. So I believe this is the last slide of our discussion regarding loss, grieving, and death. So thank you so much for listening. I hope you learned something today.